Welcome. Thank you for joining us today. I'm Karen Johnson, our Senior Director of our Trauma Informed and Brain Science portfolio at Social Current. And I'm pleased to be here today with our guests from Children and Families First of Delaware to talk about their innovative work. Social Current is excited to recognize Children and Families First of Delaware with our 2024 Innovative Impact Award for its Brain Science Training Institute. If you're not aware, this award spotlights the effort of our network organizations, their staff, board, volunteers, and partners who innovate in their work every day to create lasting change with families and communities. You know, over the past 10 plus years, we've made really solid progress in understanding how our brains develop in childhood and the interventions we can use in early childhood and young childhood to support healthy brain development. We've been slower to understand this work, I believe, and we see across the field to bring it to other populations, especially our adult population and perhaps especially our workforce. So Social Current has selected CFF for this award due to its really innovative work to embed brain science in their organizational culture, to support staff, and to be a foundational cornerstone of their trauma-informed work, and to spread out to other fields such as education and law enforcement. Their expertise in this area of brain science and trauma-informed approaches has made them a go-to resource in their region and across Delaware, and even spreading out beyond Delaware across the country. So really, we're excited because CFF's work is at the forefront of using brain science to improve outcomes. And this work is close to our heart here at Social Current because we are also, really interested in those that are innovating in this area. And CFF has been a partner with us for close to 10 years and in this work, and it's just a real pleasure to be able to highlight it today. So today I'm joined by Kira McGillivray and Shannon Fish, who are co-leaders of the Brain Science Training Institute. Welcome, Kira and Shannon. I'd love for you just to each take an opportunity to introduce yourself.
Thank you, Karen. We're so glad to be here. So I'm Shannon Fish. I am the Director of Operations and Risk Management for Children and Families First, and I'm a licensed clinical social worker. And together we co-lead our Brain Science Training Institute, and I'll let Kira introduce herself.
Thank you for having us. I'm Kira McGillivray. I'm a licensed marriage and family therapist and the Chief Program Officer of School Based Initiatives at Children and Families First. Along with Shannon, I'm the co director of the Brain Science Training Institute.
Wonderful. Again, thank you for being here. I thought we'd start today by asking you to just share some context around what led you to start this work, to train your staff, and start to train other organizations, ultimately to create the Brain Science Training Institute.
With our partnership with Social Current in our Change in Mind, we had two individuals at CFF, Dr. Julius Mullen and Kirsten Alton, who joined the Change in Mind, and they brought that back to Delaware. And in support with our former CEO at the time, they really led advocacy efforts within Delaware, including conducting an ACE study, the Adverse Childhood Experiences Survey, in Delaware with some partner organizations. And then all of this advocacy effort allowed us to help Delaware become a trauma-informed state by executive order in 2018. In that same year, CFF also underwent strategic planning and adopted Harvard's Principles for the Developing Child as part of our strategic plan, which is part of the brain science behind trauma and trauma-informed care work. And so we've really been on this journey for about a decade now. And then about 5 years ago, Kira and I came together to kind of take the Brain Science Training Institute to its next level. We gave it that name and we started to take these trainings out into the community and really create a portfolio of trainings that organizations could take advantage of based on where they're starting their trauma-informed journey.
Wow, thank you. I love the word journey. We know this work is absolutely that. It takes many, many years, a decade for you to have arrived at this point. That makes perfect sense, but you've come so far. And it's really exciting to hear about your evolution. Um, can you just help me understand or help us understand how this work ties to your mission and your organizational strategy at CFF?
Sure. So CFF's kind of mission is really dedicated to champion children and families through evidence based, equity centered, and innovative approaches. And so our BSTI team is really committed to empowering our own staff and communities with the latest research and evidence based practices on brain science. So, a lot of this information that we gather kind of determines trainings and techniques that we move forward with as an organization. And then strategically, we've really developed BSTI into what we think is a high quality service that we offer for a fee. We really believe in the importance and necessity of this information getting out there to everyone and not just to organizations in the social service sector, but we recognize the value for organizations across kind of all various professional fields that are out there. And so that's kind of how it relates to our work and our mission and our values here at.
Thanks so much. I love your idea of getting it out there to everyone, as it's in so many ways just about us being human with each other. I mean, that's a very simple way to say it, but that's the often at the core. So, can you share how as you rolled this work out and you evolved, how you saw it impact your staff, your internal staff, which I think is where you started, right?
We did. We started internally with internal training, and that was really spearheaded by Dr. Mullen and Kirsten in those initial efforts where we rolled this information out to all staff through all training. And that included our administrative staff. No one was exempt from starting to understand trauma informed care. And then we've continued that as we created internal trainers who are our own experts in this, and they continue to provide this training to all of our staff at new hire and ongoing so that we continually embed this information into the work that we do.
So you have
Kira,
really,
do you want to say something more about that?
go ahead. No, go ahead.
Yeah, I mean, I think for us, when we've looked at how it's impacted our staff, it's really helped with our overall workplace culture. And I think our retention, I can think of, and I want to shine a light on this program. There's one program in particular that has worked to really embody these trauma informed principles. They've thought about collaboration, they've thought about transparency and gathering feedback and giving some of that choice to staff. And what we saw was a decrease in separation. So in 2023, they had 15. In 2024, they've had 0. And there was a real deliberate focus on embodying these principles and addressing the needs of the individuals that were on the team and the team as a whole. And I think just in general, we've seen just a notable increase of people talking about brain science, of talking about compassion fatigue and vicarious trauma and burnout. And so within our organization, we've really normalized it. And so supervisees can talk about it with their supervisors, and we can talk about it with our leaders. And it's something that we're all working to address as an organization.
Wow. I mean, I heard two things. Shannon, you talked about sustainability in this work. I mean, it can if we don't build it into plans for new staff and bringing staff along as the skills advance, it can fizzle out. And so that's amazing. And then what you spoke to, Kira, of bringing the science into it and just how it's become part of your shared language. I mean that's that's key. That's key, and Not everyone can pull that off. So really applaud you in in giving staff the tools to be able to master their own emotions, their own state of being throughout a workday. And isn't that kind of the bullseye, the retention piece? I mean, of 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 our workforce efforts, especially as we're recovering and while we were in COVID. So really, really amazing, really impressive. Um, so you did say that administrative staff, everyone takes this training. Any thoughts on how anything you can share on how that group outside, separate from those that do direct services and work with people who have experienced trauma, they do that every day. How does the administrative staff, those people that are separate or removed a little bit from the direct service work, how have they been impacted?
I think we've really recognized that trauma informed care extends beyond client interactions. When you're doing this work, you realize that it's this comprehensive approach and it involves everything from your clients to your staff. And so when we think about trauma informed care, we recognize that we need to consider physical safety and environment, which falls under the facilities team, or we think about psychological safety, and that relates to your supervisors and even your peer to peer colleague relationships. It involves policies and procedures. So that involves your HR and your risk management and your financial teams. So creating trauma informed care is a collective effort because it encompasses everyone from clients and staff. And so throughout these trainings, either internally or externally, we ask everyone to be a part of that training. And so we've actually kind of consistently heard from the administrative staff that they're actually the first people to witness and observe the stress of whoever that participant or client or patient is. For example, in housing, we've heard that sometimes their facilities staff are the first people to recognize that perhaps someone has deceased in the home. They've witnessed domestic violence, and so they're carrying this vicarious trauma with them. Frontline staff have often described kind of getting the brunt of the stress of whoever that client is, sometimes receiving threats. So trauma informed de-escalation has really been crucial for them as well. And so what we've kind of seen, and Shannon, feel free to jump in here, is a lot of times our mental health staff kind of know this. There's areas for growth and they learn something about the brain science, but it's really our administrative staff and everyone who's maybe not directly working with clients that can gain so much from this. And it's information that they've been looking for, and it really validates the stress that they've experienced and then gives them the tools to work with the individuals.
Wow, such cool examples of how it's relevant for administrative staff. And just congratulations. That's not always easy again. And to not silo it in the clinical or case management world and bring it to everyone and make it meaningful for them so that they see it in their daily work is really impressive. When you Kira, when you talked about your organizational values, you noted equity, and I'm not surprised. Of course, CFF would be very zoned in, tuned in, and focused on equity, diversity, inclusion efforts. Can you speak to how this work intersects with EDI, anti-racism, how your brain science and trauma informed intersects with the EDI lens and work?
Sure. So Shannon and I have gone into this always believing that you cannot have trauma informed care without taking into consideration equity, diversity, and inclusion. If folks don't feel like they can show up as their authentic selves and be valued, then they don't feel safe. And if we don't feel safe, this is stress and it can impact the success of that individual, whether they're in the workplace, whether it's at school, wherever they live. If they don't feel safe, that's going to impact how they show up, how they learn. And Shannon and I have done research on how and looked this up, and it consistently shows that discrimination kind of impacts the brain in the same ways other adverse childhood experiences do. It changes the brain So anytime we do consultations with organizations, we are always assessing their EDI initiatives as well, because you just can't have one without the other.
Really important. Thank you. Uh, Thank you for highlighting that intersection. Um, so I know that you have taken this work, and for a while now. I don't know that it took you that long to take the work outside of your own staff, outside of your own organization. Can you speak a little bit to those efforts and the folks that you've been partnering with across your region and across your state?
Absolutely. So we benefit in Children and Families First in Delaware to have a lot of really great partnerships, and through a lot of kind of just word of mouth and people knowing who we are and what we do, we've had the opportunity to partner with everyone from housing, as Kira's mentioned, to a lot of our educational departments, everything from early ed to our K through 12. We've spoken with law enforcement and victim services, community health care providers, residential care, and other social service organizations to really bring this work to them. And they've come to us and sought us out in some opportunities. They've heard us from another organization that they work with, and they've just heard that the way we do this training is a little bit different, and they would like us to come in. And that even includes organizations who've done trauma informed care, and they say that they've had these trainings for all staff, but they really would like someone else to provide a different spin.
Nice, very nice. Um, and I think one of the different spins is your focus on brain science, and I'm just curious that especially when in the adult, perhaps the adult population, brain science around regulation and mindfulness and calming our lower brain, quieting our lower brain is relatively new. It's relatively new practices. I know I was never exposed to anything like that until well into my career, and certainly not throughout my childhood years. So things that are new are harder to learn. Can you share how you have encouraged individuals and organizations to try to bring these practices and embed them into their everyday work? Do you have any hints on that? Because love to hear those as well.
Yeah, I think Kira will add some examples as well, but we've really we respect the fact that we are adults and that we're adult learners. And so how we train incorporates a lot of adult learning styles. And then what we talk about is very real to everyone. No matter what experiences you've had, we've all known stress, and we've all known individuals who have been exposed to that stress. And we're kind of craving that ability to understand ourselves better.
Yeah, I mean, I think the way that we approach these trainings with our organizations is uh, we recognize the way people learn. And so we are talking about it, we're giving visuals, and we're doing activities so that this information really kind of sinks in. And I think people gain a lot of information about themselves while they go through our training, not just for other people. And so I think it kind of clicks, and we start to see this kind of more grace and compassion for themselves, which leads that for other folks as well.
I, you know, what comes to mind when I hear you saying that is off. Really, this journey starts with the individual, and it's kind of an inside out journey. We're on our own individual paths, and it sounds like you really honor that in your trainings, and that's powerful. So yeah, I can see why it would resonate for sure. And the activities you share, I'm sure people, take those with them. So, and the experiences that they encounter in your trainings, that's pretty powerful. Thank you. I think we're coming to the end of our time together. I have one final question. Do you have any tips for organizations who who are on their trauma informed journey or would like their partners to embrace trauma informed approaches in brain science?
You can get us started, and then Shannon, you want to
Okay.
finish us off?
Okay.
So I think a couple of things. What we've noticed is, in doing this work, is recognizing that folks are on a journey. And when we usually think about trauma informed care, we kind of think of that linear arrow that's always shown of from aware to responsive and informed. And what we've really found is that it's not so linear. We kind of look at it as a matrix, so to speak, that in some areas organizations are doing really well around with clients. We're really well around the environment and making sure it feels safe. But then, and so they're really kind of responsive in that arena. But in other areas, there's growth. They're really just starting that journey and aware. And so when we're working with organizations, noting the areas where they're really strong at, and then talking about the areas where there's growth. And I think that's really meaningful and helpful for organizations to see what they're also doing really well at. And I think just providing practical strategies with solutions. We don't. It can get pretty frustrating when you just hear about all the things that you need to change
Yes.
and not get those solutions to actually implement. And so I think those are two things that stand out from my point of view.
And I think with the solutions, the people who need those solutions are the leaders, and we focus very heavily on the leadership of the organization. Often, a lot of trauma informed organizations, they bring in a training, all the staff get the training, but it's really focused on the direct care staff, the individuals working with clients. And we flip that a little bit and we recognize that if you want to change your organization's culture and if you want all of the organization to take this journey with you, the leaders have to be bought in. And so they're the ones who are actually doing a lot of the work with us, and they're learning about where their organizations are strong and where they're not. And they're doing the support and the solution seeking. And they have to be bought in as the leaders, because if they're not, then it doesn't matter if all the staff got trained. They're not going to implement this actively, and that kind of continual growth won't occur.
Yeah, very good. Really good message around leadership and also focusing on successes and building on those. So, really nice points. Thank you. I'm so pleased that you are the recipients of our Impact Award. It is so well deserved and fits so well with the work you're doing and the impact you're having. So, really, really appreciate your work and joining us today to talk about it. So, thanks so much, Kira and Shannon. I'm excited. You'll be at Spark in person in Denver this October. So our Spark conference features a workshop track on brain science and trauma informed approaches, and you are both going to present a workshop on trauma informed performance management within that track. So I can't wait to see you there, and I hope those that are listening will join us in Denver. Registration is currently open. And please make sure to register by September 20th to receive the early bird rate. So with that, I'll again thank you for your time and your work, and we'll sign off. And I hope you all have a good day. Thank you so much.